So as we're seeing, there's a big hubbub in Washington. Things seem to be getting shaken up more and more by the day. Do you think that, this pandemic and the flaws in the healthcare system that it's sort of exposing, do you think that's going to make universal healthcare more appetizing to lawmakers?
I, and again, MGMA, this is not a position we have, it's just the reality we live in. There are a lot of challenges with moving toward universal health care. We have a system, the for-profit system now is very complicated. There's a lot of vested interests. And I've found this in my 20 years of being in Washington to be easier said than done. And again, I'm not talking about single payer. I'm just talking about healthcare reform in general. We saw a huge pendulum swing with the Affordable Care Act as an example, only to have it swing back as the next administration came in and started to limit some of those provisions of the previous administration. So if I had to predict, I tend to predict more of a middle ground type of approach. What we're seeing now is our system is going to care, especially our hospital system, the way the laws are written with EMTALA and other laws, that patients are going to be seen. There's by law provide, medical practices and hospitals are having to stabilize patients, and they are being seen. It's just the aftermath, the financial aftermath of all of this. And whether it's preventing, I think, a lot of it comes down to prevention. And while I personally don't necessarily see single payer as imminent, I do see, hopefully our healthcare system will learn from this, put a lot more prevention into these type of potential huge, economic and clinical catastrophes like we're dealing with now, but also fund more preventive care and open up some doors to potentially the Medicare program. Perhaps let those individuals who are 55 years and older buy into the Medicare program. And I think that would even help the Medicare program on some level, which you would be able to provide more preventive care as the population ages, and they go 100% on the Medicare program when they turn 65. So, do I think this is going to move everyone to single payer right now? No, I think it's just too politically, it's a hot potato, and I don't see it happening. I mean, just think about our the way we educate physicians in this country. They're often saddled with somewhere between $250,000 and $500,000 in debt. We would have to reform our medical education in this country. We'd have to figure out how we would reform payment associated with single payer. Right now, a lot of the federal programs pay lower than a cost. Certainly Medicaid pays below cost, and those lower revenues are offset by higher premiums or higher revenues that practices bring in from commercial payers. So there's a lot of subsidization of programs, and we'd have to work through all of this. And at this point, up until this crisis, it's been a difficult road for the federal government to really to move toward, and there's just tremendous amount of disagreement as to whether or not this would be good or bad for our country.